This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. She's an elderly lady of 75 years old. She has a mature intumescent cataract. On the outside it looks white cataract, but we have a surprise underneath it. The two side ports are made. The capsule is stained. The antechamber is pressurized with OVD. The main 2.8mm incision is created. Time to perform the rhexis. As soon as the capsule is punctured, there is a little egress of cortical matter out, and this usually decompresses the bag good enough. As the rhexis was being done, I prefer to stabilize the globe using a second instrument. In this case, it is the Sensky hook. I don't do a two-stage rhexis in these cases, or most cases nowadays. Just pressurize the chamber with a good OVD, like a cohesive OVD, and then make a primary rhexis, which is about 5mm. And that's what we have achieved here. I don't usually do any hydrodissection. I'm just tapping the nucleus to ensure that the loose cortex just flows out. A little bit of OVD is burped out. Time to emulsify the nucleus. As soon as the superficial cortex and epinucleus is aspirated out, what lies underneath is a hard brown grade 5 nucleus. This was a little bit surprising. I wasn't expecting it. This is how some of the mature cataracts can camouflage. You can always have an underlying dense nucleus which can be covered by a milky white cortex, and we are under the wrong impression that the nucleus could be soft. So in these cataracts, my strategy is to make a small central pit by using the sculpt mode. The diameter of this pit would be around 2mm or 3mm, and depth would be around 60%. And then the tip is buried deep into the substance of the nucleus. This depth of 60% gives me access to the core of the nucleus. The entire exposed tip is buried so that I get a good hold, and then the chopping maneuver is done. I'm just doing the vertical chop and holding the nucleus and then doing a lateral separation. During the next chop, there is a slight torque. Let me pause here and replay this. Let's try to analyze why this torque happened. Well, the main reason is the tip which is holding the nucleus is not deep down. It is slightly more superficial, and because this is a very dense nucleus, the moment chopper goes down in, the hold is not adequate enough to separate all these dense fibers which are holding this nucleus. So the number one reason is hold was not deep enough. Number two, we're holding at the 1/3 and 2/3 junction. There's another reason why the nucleus can torque a little bit. The posterior plate might be difficult to break, but a couple of attempts would ensure that the attachments to the posterior plate are significantly thinned out. So it's just a matter of being a little bit patient and being very mindful where we keep the second instrument when doing lateral separation. If it is positioned as deep as possible, even the gentlest lateral separation maneuver is going to yield us good results. Now the fragments are freed. Couple of fragments still have a posterior attachment which will be dealt later on. The first fragment is emulsified.
Because each of these people have almost observed more than 5,000 cases. So Nagaraj is our youngest breed.
I go in and refill the chamber with OVD, and the chopping and the fragment emulsification procedure is being continued. Now these two fragments are attached at the base. So what I'm doing is I'm just flipping this base up and using direct ultrasound energy in the sculpt mode with low flow rate and vacuum. I'm just using a small burst of phaco which destroys the bridge. So now all the three fragments are free again to be emulsified in the quadrant remol mode. In the quadrant remol mode, where you're going to use high vacuum, high flow rate along with torsional energy. But the most important tip for a clear cornea I would like to share here. Now look at the plane at which the fragment is being emulsified. I'm going very slow. So if it is far away from the endothelium, be rest assured that the energy delivery which you're using is going to cause minimal toxicity to the endothelium. The second aspect which you need to control apart from the plane of emulsification is the turbulence and lens chatter. And you can see that the fragment is just dancing around the tip at the level of the rhexis margin. We can minimize the turbulence and lens chatter by using the appropriate power for the lens. If I can use more power, I can eat off this nucleus in a jiffy. But what it does is it's going to splatter the nucleus around, and multiple fragments are going to be thrown away and hitting the endothelium and coming back. So this is what we call as a lens chatter. We can minimize this lens chatter and turbulence by just toning down on the phaco energy. If we are very judicious and using just enough to emulsify the nucleus, we can ensure that the nuclear fragments are not repelled away from the tip and they're constantly held and emulsified. Although it can make the procedure a little bit more slow, almost this would take 3 to 4 times than what we can emulsify this if we use a significantly higher energy. But the collateral damage to the vital tissues like the corneal endothelium can be significantly minimized. So 2 things. Number 1, plane of emulsification, and number 2, minimize the lens chatter and turbulence. Of course, the third point would be if you can hold the second instrument, the Sinskey hook, just above the tip. It acts like a shield or a guard and prevents the flying away of fragments in the antechamber which can potentially hit the corneal endothelium. So just watch these fragments dancing around the tip. That should how your energy delivery should be, and it can be controlled by your foot. The epinuclear sheet is manually lifted up by the Sinskey hook, and then the phaco probe holds it and then emulsifies it. The cortex is aspirated out and chamber is filled with OVD and the lens is placed in the bag. OVD both in front and behind the lens is aspirated out. Well, in this case, I just wanted to highlight the points which I have summarized in many videos previously, that to achieve a clear cornea in these dense cataracts, phaco energy alone is not important, okay? What is important is the plane at which we deliver this energy. So, 2 critical factors, the plane of emulsification and the amount of lens chatter and turbulence we generate in the antechamber. And we can control the lens chatter and turbulence by using the appropriate energy for that density of the nucleus. Hope you found this helpful, and that's it.